My name's Devin Zeminski. I'm from the Walter Rand Institute at Rutgers, Camden, and I'm going to be presenting on behalf of our team this afternoon. We partnered with Inspira on the 2025 to 2027 Community Health Needs Assessment, and we're releasing the reports this week, so very happy to be sharing kind of an overview of the results today. And I'm going to go through things very at a high level, and I also want to give an opportunity for Donald Noblett to talk about the implementation plans following the CHNA, and then have some time for questions before the end of the meeting. And just a quick background on the Walter Rand Institute. We are a community-focused research organization based at Rutgers Camden. I know many of the folks on the call are partners of ours, former, current, and maybe future. And we focus on the 8 South Jersey counties and are really responsive to the issues of the day. So some of our projects really range from transportation, workforce, substance use, broad social service, and public health components. And so again, I'm going to just go over kind of the goals of the CHNA, go over this process of how we really heightened and centered community voice in the CHNA, the findings, and then we'll have some time for questions. Okay, and so the CHNA, as many folks on the call are familiar, is an IRS requirement for tax-exempt hospitals. And it's really through a mixed method strategy to try to identify what are the assets in our communities, this case, the communities being Inspira's service region of Salem, Gloucester, and Cumberland County. What are the related needs? What are some of the gaps? And then what are the solutions? So kind of what's working, what maybe could be working a little bit better, and then how could we work together to improve some of those health needs, health outcomes. And then how we approach this process through our methods was, as I mentioned, a really combination of interviews, focus groups, and a community survey. And I will also note that the prior CHNA from 2022 to 2024, that data was collected during COVID, so that was all online. And then when we did all this data collection last year, folks from the community were really eager to speak to us. And so we're really happy to report that we had high engagement for a lot of our in-person community outreach, which involved going to local libraries, different social service agencies, and public spaces to engage with our local residents. And then when we think about the folks that responded to our call to engage across the 3 counties, we this time focused again on specific subcomponents within each of the 3 counties in Gloucester, Cumberland, and Salem. And then we also did interviews with our key stakeholders. And so you can see based on the colors here that we had a pretty even split across our focus groups and our community survey between the 3 counties, and then also across the region. And then breaking down a little bit more, our focus group demographics, predominantly community members, roughly people in their 40s and 50s, most people women, most people identifying as straight, and then about both half and half folks who identified as white and black. And then for the survey, similar numbers, higher percentage of white folks participated, again, around that average age of in their 40s and 50s, and again, predominantly women. And I'm just going to highlight some of the findings from our survey before I go into sort of the overall aggregate findings from the region, and then a quick touch on each of the 3 counties. And so most people have currently or do currently go to Inspira for healthcare for various things. And this is true, again, very much so across our counties and across the region. And then specifically for this presentation, because it's the Cancer Coalition, we just wanted to highlight that when we asked folks to identify their top 5 medical health issues, we also asked about community health issues. Cancer across the 3 counties and across the region did appear in those top 5 or 6 medical health issues. You can see some of the other ones highlighted here included hypertension, other related cardiovascular diseases, dental health, highlighted in yellow, and then some of the other top ones were mental illness, diabetes, and obesity. And then among the folks that specifically selected cancer as one of their top 5 medical needs, when they were asked about specific medical resources that may be missing in our communities, these, as you'll see in a few slides, very much so mirrored the missing medical resources across the whole region, and these are related to things like healthcare access. You can see the highlighted health screenings and low cost of services for people who may be getting screened for cancer. So again, really these ideas of access and availability to health resources related overall and to cancer, and then making sure that cost is affordable in the ways that it can. Okay, so then starting with the regional findings, for each of the counties and the region, I'm going to go through assets, barriers, and then solutions and recommendations. And so across the region, and this data was aggregated again across our interviews, focus groups, and our survey respondents throughout the reports, which are going to be released tomorrow, I'll mention in a minute. But across the region, the assets that the data highlighted really spoke to this robust and growing public health infrastructure across the South Jersey region, but specifically in our tri-county area of Salem, Gloucester, and Cumberland, and how there are a lot of specific resources for food access, STI testing, substance use, infant and maternal health, and that people really appreciated the growing community connections and opportunity to provide feedback about certain programs and where funding may be allocated. Overall, the top 5 barriers across the region that you'll see echoed in the other counties as I go through, cost of living undoubtedly across all of the data rose to the top. And folks really talked about challenges in meeting basic needs, things like groceries, transportation to get to work, to get to school, challenges in affording rent and health and home costs. And this kind of relates to the second main barrier of cost and availability of healthcare. Findings really spoke to how if someone has, $20 at the end of the week, they're gonna use that money to pay for groceries as opposed to potentially, let's say, paying for a copay for a mammogram. And so really the data spoke to that trade-off when people were thinking about rising costs of living and sometimes health going to the back burner, and related to that, how sometimes costs to get to healthcare, like that loss of wages if you need to take off work, paying for childcare, the cost of transportation is also an added cost that isn't necessarily when you're at the doctor's office, but kind of before and after you get to the doctor's office. And then again, across the counties and across the region, you'll see that chronic illnesses really around a variety, things related to physical and mental diseases and illnesses, cardiovascular, mental health, substance use, diabetes, obesity were chronic issues that were repeatedly mentioned as challenges in our region. The fourth one is community connections and spaces, and this really spoke to the desire for a third space where folks could connect. That's not necessarily where they're living and it's not necessarily where they're working, but where people could engage with other community residents, maybe to take a cooking class or learn, for those who are ESL learners. And then the last regional barrier really speaks to this idea of administrative barriers. And so these are things like staffing challenges, incentivizing folks to remain in our South Jersey region through competitive wages, and some of those challenges around different New Jersey counties not or meeting federal requirements and even state requirements for what constitutes a rural area. And then also thinking about creative ways to use hospitals as opposed to having big hospitals, thinking about maybe smaller clinics, outpatient clinics, and what that might look like with certain legislative barriers. And then when we asked folks to talk about some of the solutions, some of the ones that bubbled to the top from the region talked about, again, really leaning into our partnerships that exist and continuing to nourish those partnerships in creating connectivity around our different public spaces, around our different practitioners, and being authentic in those relationships. When it comes to the healthcare aspect, people also talked a lot around bringing different services to communities as opposed to having community members needing to travel out to find services, but bringing resources in one-stop centers and co-locating services so somebody could, get a vaccine and then get a dental checkup maybe in the same space. And then the data also spoke to the desire to really take the findings and advocate, given changes in funding, and letting our South Jersey legislators know here is what folks are saying about what's needed and how could this be used to potentially advocate for the community. Okay, so then briefly I'll go through the 3 counties. Cumberland County, again, the assets really focused on how folks appreciated the existing community centers and how these organizations provided critical support in teaching things around financial literacy, doing food classes, clothing distributions. And the Vineland and Inspira Life Center got a particular shout out for its strong community engagement. Barriers, you'll notice for Cumberland that, again, the top 2 are going to be related to cost of living and the cost and availability of healthcare. And this also includes things related to, cost of prescriptions, challenges with insurance coverage, particularly for folks that may be going across the way to Delaware or into Pennsylvania and Philadelphia, mainly for our Gloucester and Salem folks. Again, chronic illnesses also at the top. And for the 4th one in Cumberland, community connections and spaces was also true, particularly regarding concerns around community and individual safety. And so the data really spoke to thinking about safe spaces where youth can engage in after-school activities and extracurriculars. And then one of the unique findings from Cumberland County spoke to this idea of compassionate care, which talked about thinking about ways to address potential discrimination that folks had expressed in receiving healthcare and how stigmas can be reduced with certain populations and overall towards increasing quality of care. And then the recommendations for Cumberland focused on creating places where people can access information about community events and healthcare, these ideas of community hubs to increase that awareness, hiring local experts who are familiar and have trust within the community to not only work in these places, but also to help get that information out there. As I mentioned, continuing to expand safe places and safe spaces, and increasing healthcare access through low-cost options and transportation services so folks can make it to available appointments. Okay, moving on to Gloucester County. Data from Gloucester really spoke to, again, the value of community programs, particularly within Gloucester around programs that focused on leisure activities and recreations through like concerts in the park, farmers markets. And folks also talked about increases in potential opportunities due to that proximity in Philadelphia and having more access to additional providers than maybe in some of our other counties. And there was a really strong highlight of the collaboration between different sectors, such as local government, nonprofits, and faith-based institutions. For Gloucester, the top 2, again, are going to be cost of living and cost and availability of healthcare, mirroring a lot of the challenges that I mentioned for Cumberland County. And then for the 3rd main barrier in Gloucester, there was a lot of data that spoke to, again, the co-occurring challenges with mental and behavioral health and substance use, particularly around this idea of short-term inpatient or outpatient care and the need for long-term care, that someone's recovery journey is going to take longer than 2 weeks, and how do we figure out how to bring people and organizations together to support people in that continuity of care. And then again, for our community connections and spaces, in Gloucester, this was particularly attuned to, again, our youth population, but also our older adult population, and finding places for people to go, and also providing ways for them to get there. So thinking about transportation options, where folks who may not have access to transportation, who are unable, can get to where they need to go to engage with other community members. And then Gloucester, one of the other barriers that was unique to this county was this idea around health education and kind of combating misinformation around certain sort of health trends or ideas. And so thinking about ways to provide information in accessible and approachable ways to community members. And the recommendations, as I mentioned, these community spaces really trying to increase available opportunities to engage through education, life skills training. And there were definitely pointed data points about increasing connections with Rutgers, Camden, and Rowan University and other local institutions in kind of moving towards creating more community. And then along with that, making sure that these initiatives are developing a authentic and genuine community trust, and that there is consistency for folks who maybe are a part of a grant project or are a new nonprofit, really making sure that all parties involved are coming to engagements authentically with accountability and with flexibility in how they're working with community and other existing institutions. And then the last recommendation here from Gloucester was thinking about how the infrastructures overall across the social sector and healthcare can continue to kind of fuel that infrastructure. And then for Salem County, the assets, again, really across the board, local community organizations were sort of the beacon of light among many of the folks that we spoke with for providing assistance across a range of opportunities. Particularly here, I'm highlighting different medical programs for people that are uninsured and underinsured, different housing programs and housing vouchers, and food pantries for folks that need to increase food access. And again, having the organizations in Salem that are working together really was a highlight from the data. And when it comes to barriers, the thing I'll say about differently between Gloucester, Cumberland, and Salem is that the idea of the cost of living in healthcare for Salem, you'll notice that it's combined. And the reason for that is because in Cumberland and Gloucester, the cost of living, those basic needs, was really, again, at the forefront. And in Salem, that cost was also at the forefront, but it almost was in tandem with and secondary with costs are a massive issue, but also there's that lack of infrastructure that those costs are already not even able to they're already sort of in competition with. So thinking about how that infrastructure can help reduce some of those costs, particularly the lack of infrastructure around public transportation and healthcare, and how that, again, limits access and then also increases those daily costs of living. And again, chronic illnesses at the top here for Salem related to mental and physical conditions, as well as community connections and spaces. And then the last unique finding for Salem here is around food access and availability. A lot of the residents that we spoke with highlighted, okay, living around all these farms and different food opportunities, but not being able to access them, whether it was through not having a low-cost grocery store in the Salem area or not being able to afford the prices of local foods and particularly healthy foods. And a lot of the recommendations too from Salem mirroring some of the other solutions and recommendations from the other counties, highlighting that development grant opportunities to be, again, genuine, flexible, pointed, and longer term where feasible, and continuing to think about ways that nonprofits, healthcare providers can try to do training and think about ways to reduce internal bias and stigmas against particular populations, and thinking about ways to increase information sharing through community events, through online and print media in both English and Spanish and other languages where appropriate, and continuing to provide different skill classes. And overall, as I mentioned, thinking about bringing greater infrastructure to Salem that can support those co-location of services, so people aren't having to travel 45 minutes here to go to point A, then to point B, and having to take a whole day off of work to do so. Okay, so then I'm going to talk a little bit about next steps. So as I mentioned, we are very excited to be releasing the 4 reports. We have the main regional report and the 3 breakout reports for each of the counties that will be released later this week. And then we'll also be sharing information about additional online drop-in sessions to engage with the findings in the first week of May, so stay tuned for that. There's just a QR code to our website where the reports will be posted. And Inspira, and I'll turn it over in a second to Donald, has recently finished the community health implementation plan, thinking about how this information from the CHNA will be taken forward. And so I will stop sharing. I will just put my email here and my phone number. If anyone has any questions, please feel free to reach out. We welcome and want to keep the conversation going.